Hey there, this is Mrs. Buck. I hope you enjoyed that exercise. It is one of our favorites that we get to do in post-conference had we been meeting in person. So we decided to see if we could facilitate it in the virtual sense in order for you to be able to get some good information from it, and I hope you were able to do that. Right now, I'm going to close the loop on some of the thought processes that you might have had and see where you guys ended up. I'm going to give you my interpretation of where I think some of these patients should be and some rationale behind it. So to start off with, I think I'd like to see our gastroenteritis patient first. That would be patient number 3. This patient is the most concerning to me as she is hypovolemic and could go into hypovolemic shock. The decrease in her intravascular volume leads to the decrease of venous return back to the heart and therefore decreased stroke volume. Inadequate perfusion results in impairment of nutrients and oxygen delivery to vital organs, which will result in systemic organ failure. In that regard, decreased sodium could also result in seizures, which is what we have with this patient as well. And decrease in potassium will also cause some important arrhythmias, as you well know. So volume depletion reduces the effective arterial blood volume, decreasing perfusion, which we just talked about, and both of those are latter signs of dehydration, of severe dehydration. Therefore, this child nor a parent is going to be able to manage this without appropriate resources. So this child does need to be admitted and managed for inpatient fluid resuscitation. So next, I would see our patient number 4, who is our febrile seizure patient. This patient did have a witness seizure, and Ativan has been given. And if the seizures were to continue and he were to acquire more Ativan, his airway could potentially be a problem. Febrile seizures happen because of the short interval of time in which the fever rises, and you will learn that in a lecture. Mrs. Gardner will go over that with you if she hasn't already. So in that regard, now due to it happens because of the time interval that the fever happens, not how high the temperature goes. And of course, we know that this child does not have a high fever. If they're true febrile seizures, one would medicate with Tylenol around the clock until the cause of the fever can be determined. And so long as the patient's airway is protected, then they can eat normally and maintain hydration. They should not need oxygen. They will likely have antibiotics ordered for a select period of time to rule out any bacterial causes of the infection. And an EEG and a neurology consult would also be helpful in ruling out epilepsy versus the febrile seizures. So this child would be admitted to the pediatric floor, likely for observation to facilitate those diagnostic studies, but could be managed and could do well, providing their airway maintains and remains stable. Next, I would see our respiratory asthma patient, patient number 1. This patient, his airway is also of concern. However, he did respond nicely to treatment. Having this child on scheduled albuterol treatments with successful responses with advancing to longer intervals in between and maintaining oxygen saturations are certainly determining factors for him. He also received oral steroids to decrease inflammation in his airways, and his diagnostic testing was unremarkable. He continues to wheeze, however, and has had multiple admissions, but as we know, wheezes are not always bad. He probably needs some pretty significant asthma education because of those multiple admissions, and this child will likely be admitted to the pediatric floor until he does not have an oxygen requirement, and his nebulizer treatments can be spaced out every 4 hours. And then lastly, I would see our post-op patient with the ruptured appendicitis, or the ruptured appy, secondary to appendicitis, sorry. This patient appears to be your stereotypical post-op patient. My notes are going to fall off my easel here. The doctor could see him next. He does have a low-grade temperature and some pain. Keep in mind he's only 7 hours post-op. He does have an NG tube due to the ruptured appendix to prevent peritonitis, so that's pretty normal. The color and amount of drainage indicates his bowels have not recovered from anesthesia yet. They're not fully awake, and therefore he should remain in PO. So nursing wise, you probably would want to moisten his mouth with glycerin swabs for comfort. You might be able to advance him to some ice chips, but we'll do that slowly and certainly not without a doctor's evaluation or okay. Evaluating all components of his pain and medicating him will help significantly. Morphine will help the surgical wounds, the pain that he has there. He also has not voided post-op, so the fact that his bladder may be distended could be causing some discomfort. By medicating him for the surgical pain, he'll be more likely to possibly stand up and use the urinal to void. Remember, most male patients cannot void sitting or lying down. So medicating him for pain will also promote him using the incentive spirometer and allowing him to effectively turn, cough, and deep breathe, which will help that low-grade temperature. Those shallow breaths are what's contributing to that, not to mention the fact he is post-op, and it is normal to have a little bit of a post-op temperature. He is complaining of chest and shoulder pain. He had laparoscopic surgery, so the gas that they instill into the abdominal cavity is quite painful, and the patients need to be able to get up and walk in order for that gas to dissipate. So once a bed becomes available, this patient could be admitted to the PEDS floor until the NG tube could be removed and he could tolerate some PO consistently and be on PO pain meds. And barring any other infectious processes or infectious looking diagnostics, he is pretty normal, pretty stereotypical post-op patient. So I hope that helps close that loop with this exercise. I hope you got something out of it and you enjoyed it. So thanks so much for participating. See you soon.